Hi there. Welcome to The Preventable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to The Preventable. With me today is Matt Woods, digital content producer for KMOV, and he and his team are this year's recipients of our Gateway Award, which is really exciting. Did I say that right, Max? I'm looking at you in the corner. Okay, the Gateway Award, I was going to say. And really, we give that for a media company, somebody in the media who is shining a light on our field. And you certainly did that this year, you and your team. So welcome to The Preventable.
Thank you so much for having me. I'm glad to be here.
So you did was it an hour long?
Just about 50 minutes.
Okay.
Yeah.
A 50-minute special that ran prime time that had lots of kind of digital components beforehand and after, solely dedicated to the overdose crisis. Like, that's pretty incredidy.
Yeah. I mean, we had no idea that it would balloon into the project that it became. Initially, I had been working at KMOV for a couple months. I pitched to my boss and the special project producer that I wanted to do a story about fentanyl. We're like, yeah, okay, let's do it. We interview like 3 or 4 people, and we're just like, man, there's really a story here that's just not being told, that doesn't get enough attention. And so we ended up interviewing 20-something people. It ended up being a 50-minute documentary. Like you said, there was a special that aired. And yeah, it just sort of became way bigger than we definitely imagined.
So you just said a lot there, and I want to unpack this. So you're fairly new at KMOV, Channel 4, basically, if you live in St. Louis, and you pitched this story. Talk me through that pitch. How did that go?
Well, one of the things that that KMOV had brought up in my initial interview there was that we do special projects, digital exclusives, sometimes we call them. And I think everybody at their heart, in the digital content area is sort of, we want to report. We want to also do the stuff that the TV reporters do. And so it was just this thing. I'm like, this crisis is something that's happening largely in the dark. I really want to learn more about it. I ended up just looking up like books on the fentanyl crisis and found a book called Fentanyl Inc.
Yep, by Ben Westhoff. Yep.
And I'm reading the first 3 pages or whatever, and I see that he's talking about St. Louis, where he lives. I'm like, what? This is huge. All right, I got to interview this guy. And so I called some people, called him, the DEA, and then just a bunch of other people. We ended up highlighting people who had used substances, people who were in the treatment area, moms who had lost their adult children to overdoses. And so we tried our best to make it like an all-encompassing project to really show the depths of what the crisis looks like today and how we got here in the first place.
Right. And that, to me, I think was something that a lot of us appreciated about the special and the coverage, was that you addressed it from as many sides as possible, right? So you talked about how did it get here, you talked about the supply side, you talked about the demand side. Selfishly, really stoked you included prevention education and beginning in kindergarten. I remember when we first talked, you were like, wait, back up the truck. What? But then you also talked to people who had lost kiddos and people who are in recovery, right? And there were just lots of sides of the story, which to me is very rare, but very much appreciated. And I think that's why locally, and I know at other places as well, there's become so much traction around this, because you spent 50 minutes And 50 minutes is not enough. I'm sure we could talk about like how do you decide what to edit and how do you decide who to feature and who not to feature. Like that must be really hard. But you devoted 50 minutes in primetime television. You weren't showing like whatever, Chicago PD or Big Bang Theory or whatever. Like this is what you were talking about. Like that's a BFD. That's a big friggin' deal, you know? So that's why you're here. And I just want to say like thank you from our field. Thank you for shedding a light on all of the different aspects, because as we were talking about before, there's not a strategy that's going to get us out of this, right? It's not just Narcan. It's not just needle exchange. It's not just prevention education. It's not just law enforcement. It's like all of it.
Yeah, I think the more that I read, research, and report on this, the more I realize that I don't know, which is a good thing. It's a very complicated issue. People need to understand that. And they also just need to understand that these are humans that we're talking about. And I think if I wanted people to come away with one thing from the documentary is just to feel a little more empathetic about people's lives, because there really are a lot of people who think that because it doesn't affect them that they don't need to care, or that, it can never happen to me. Mm-hmm. It could never happen to my kid, not in my house. Mm-hmm. But it does. And we hear the stories, and to the point of, who to include in the documentary, I think as journalists, we always have to think about who has a stake in this. Obviously, the families, the people who are struggling with it themselves, but there are so many people that this crisis touches along the way that their stories need to be told too, right? So,
Did you always want to be a journalist?
And
are you from here?
I wish I had. I'm from Granite City.
Oh, okay. Cool.
I went to Granite City High School and then Webster University. So I've always stuck around.
Program, right?
They do. Yeah. I had some great professors at Webster who really helped me craft my love for journalism, and not just. Originally, I was like, I'm interested in sports. I could be a sports journalist, sports broadcaster, reporter, something along those lines. Mm-hmm. But as I took some more journalism classes, I just sort of got a liking for just reporting on news as well. And so, I think I've kind of hung on to that. And I also just love documentaries in general.
I'm such a documentary nerd. What's like the last really good one you've seen? Besides yours, of course.
Besides, I haven't watched it in a while. There was a really good documentary series on Alec Murdaugh.
Oh yeah.
On Netflix. Case was a lot more complicated than I thought. That one, there was a really good one on Peacock about Casey Anthony that I watched not that long ago.
Okay.
It was really, really good. And those are the ones that come up are always like the real crime ones. But there's a lot of really good ones out there. So that long form content is something that I've really begun to like. So
you make this pitch to your like relatively new bosses. How long were you there before you make this pitch, by the way?
I think it was 3 months.
Okay, cool. Maybe so 3 months, you're like, I got an idea.
Yeah.
And we're going to talk long form about fentanyl in St. Louis.
At first, I think I said, all right, we could have 4 separate parts of this and have one part be like the families and one part be the law enforcement and the paramedics, which actually didn't end up getting in there.
Maybe that's part 2.
Part 2, yeah. We actually are working on a follow-up. So
okay, all right.
Yes,
so we're going to come back to that.
Love
Okay,
to talk about that.
So you make this pitch. Part 1 is families. Part 2 is like law enforcement, paramedics.
And then I can't remember exactly, but that's how we had it. And then we're just like, our project producer at one point was just like, I think it just needs to be one thing. Like these are all just encompass each other so much that let's just put it into one.
So I love it. So if you're a media personality listening, or a reporter, don't take offense to this, but, you know, when we get requests and it's like, hey, I'm Matt Woods with Channel 4. Would you like to speak on this? It's awesome. And sometimes it's a little like, here we go. Because you have this amount of time, right? And so the crew will come out, we'll rearrange our schedule because we want to be available. The crew will come out and they'll interview you. And usually what gets on air is like, we're concerned, or cannabis is bad. And it's like, no, that's not what I just said, right? And so I'm not going to lie, when I first got connected with you, I'm like, okay, let's talk about fentanyl. But your approach from the very beginning, I felt, and I know lots of other people felt like this, was different. Like, you weren't trying to get a soundbite, you were seeking to understand. And that led to several other interviews, and you were a real, like, detective in a way, because something would come up and you'd be like, well, who would be a good person to talk to about that? And who would be a good person? I mean, I'm assuming that's what's made this so great, right? Is that you were able to dig and keep digging and keep digging.
Yeah, we used, besides the amount of people we talked to, I think we really used data to our advantage. Obviously, the CDC has data for, like, nationwide, but we also got specific data from St. Louis City and St. Louis County Medical Examiner.
Yes.
And that would show us, like, it was really comprehensive. Like, everything besides the person's name, honestly, was, you could see what types of drugs were involved. And so, you know, when you see 360 out of 425 or whatever, something similar to that, of the deaths were involved fentanyl. Okay, well, that's something that obviously we need to highlight.
Yeah.
And so you start with the fact that so many people are dying, we have to fix this, and then you just kind of sort of work backwards, I guess, to try to figure out narrow down what the problem is, what the problems are, and how the system could work better to sort of fix that, because there's so many. The system is a beast, right? So to change, that has to be tweaked and changed. People have to buy into that. So
yeah, and the system is broken. Let's face it. I mean, there are parts of the system that are really trying, and there's innovation, and there's, you know, more funding now than there has been before, but we still have a long way to go. So yeah, it can feel overwhelming sometimes to make a change. Were there times where you felt like this isn't going to go anywhere, or it's too long, or it's not long enough, or am I really capturing what I want to capture? I mean, talk to me about, like, any sort of challenges you had along the way.
I think the biggest challenge is probably that we had so much information. I don't think we had an interview that was less than 30 minutes, which that's one of the other things, that we just had the creative freedom that when we go out on these shoots, we're not producing a news package for that same day. We're producing a package that's, we don't have a deadline, basically.
Did you have a deadline?
We did not, which is great.
This is, like, kind of earth-shattering for local TV news.
It's sort of unheard of.
Yeah, right, exactly.
Like, you know, you imagine, like, the bosses are, all right, you got to get it done by this date. And
right. Yeah, usually a reporter's like, yeah, I got to get this on by the 5 p.m. news, and you're like, it's 2 o'clock. Like, how is this going to work?
Yeah, so that's real, and I don't know if I would ever want to do that.
I don't blame you. I don't blame you. Yeah,
I see them, and it's a hustle. It's a sprint every day for those guys. But and I'm trying to remember what your original question was.
You were talking about how much content you had. I mean, I would imagine you had, like, hours of content that you had to get down.
And so, yeah, when you have 23 interviews, and it must have been 20 hours of just interviews, we have those logged, and we know what the most important stuff. We have, you know, our best parts of the interview, interviews in there. We have our most knowledgeable subjects on this part talking about this, but it's also like it has to be cohesive. It has to come together. There has to be so much extra footage, not just the interviews that you add into it. So there's, I mean, if we had more footage, just raw footage, that you see a lot in documentaries, it could have been an hour and a half. It could have been 2 hours. But 50 minutes is really lengthy for local news. Yeah. To produce a piece like that. So,
I was going to say breaking the fourth wall, but I don't think that's what it's actually called. You can tell me what it's called. But here in the studio, we have one of your team members who is not coming on air or on video, which is totally fine.
I tried.
We both tried, I know. So, what is it called? It's not breaking the fourth wall. What is it called?
Contaminated.
Yeah, okay.
I should have said that in the first bite. Contaminated, the fentanyl crisis in St. Louis.
I mean, what is it? Yes, say that again.
Contaminated, the Fentanyl Crisis in St. Louis is the actual name of the documentary.
Yes. What is it called where I'm like talking to people in the room, but they're not actually on camera? What's that called?
Oh,
it's not. It's
does
like
it have a name?
I don't know. I feel like you would know this as a documentary person.
I don't think so.
A documentarian? Is that what it's called?
Oh wow, I've never. I will gladly take the title,
Own it. Okay, we can include that like in documentarian Matt Woods. Okay, so anyway, you had an amazing team that was working with you, including some really great editors who are not going to come on camera. But could you talk a little bit about your team?
Absolutely, and I wish Sada would have come on so that she could bounce some ideas off me, but it's okay. Yes, so basically, and there were more than just myself. We have a video producer / editor, and then the special project producer. And so essentially, it was us three doing the bulk of it. I was doing the reporting, who should we interview, and actually doing the interviews, getting the data, all that good stuff. And then once we had the interviews, sort of just having that conversation of what are we missing still, and how do we convey the message that we want to convey, the narrative.
Right.
And so Sada actually, all the video editing, that's her. All the newspaper clippings and the music and all that stuff, that was all her. And I would just sort of look over her shoulder and sort of help her figure out what the best sound was from the interviews, and that sort of stuff. So
it's really a collaborative project. Yeah.
Absolutely, and it really needs to be, because you never just want to have one perspective on really any piece of journalism, and whenever you just different people just think of the different things that you need to produce that final product, basically.
Right. So is it weird to watch your work, or do you like to watch it as you said a while ago, you're like, it's been a while since I've watched it. Like, do you actually watch it? And is it weird? Are you constantly critiquing yourself and being like, ooh, I should have done that, or you should have used this music instead of this, or?
Well, yes, you're always gonna beat yourself up on, oh, why did I not ask this question here? And that's just something, when you're in the interview, it's hard to, sometimes you just miss stuff.
Yeah, of course.
And so, yeah, but at the same time, I guess, I can't remember what the original question was again, sorry.
That's all right. I was asking if it was if it's weird watching your work.
Oh, yeah. It is. And
I mean, I hate watching myself, but I also know that's kind of how you get better, right? Or you anticipate, so I understand there are actors and actresses that are like, I've never seen that movie, but also really? Is it really true? Because how do you know how to do better? I don't get it. I mean, I hate watching myself, and I'm always like fixated that I'm like, oh, my hair was out of place, or that color looks terrible on me, or I really should have said this. But then the next time, like, I don't wear that color. I wear a different color, or, like I get better.
Yeah, I think I've gotten used to hearing the sound of my own voice, so I don't really mind it anymore.
Yeah.
But after we finished, I mean, we had watched it through so many times.
Oh, I'm sure, right?
That like here, the first draft, the second, and then the 20-something draft. The only time I actually watched it after we published was just to make sure that there were no like spelling errors and stuff like that.
Yeah, because you kind of look for something different each time you're watching it, right? Yeah. So you mentioned there's a part 2 coming, maybe?
There is.
Can you talk
there
about
is.
it?
Yeah, absolutely. So we got together and thought, what are the things that we didn't get to in the first part, and who could we talk to now? And so there's sort of 3 parts: is identifying the gaps in care where people fall through the cracks.
Word. Yep.
And how the barriers to get that treatment and the recovery services that people need, why so many people don't get those services. And that's complicated. So we're sort of trying to dig deeper and talk to people who have researched a lot of the overdose crisis and know sort of how the ecosystems of treatment and recovery services could better work to get the people who are most at need often have the least access to the services, right? So, I guess it's sort of easy to say that, but it's another thing to actually identify it. And
then to like illustrate it to where like a average person who turns on the TV can like understand it, right? Like I've been in this field for 15 years. We have certified peer specialists, 5 of them, who all have lived experience, or what I've just been told to say, living experience, because they are still living experience in this work and in this space. And they were telling me yesterday that, because we have 5 of them in-house, and they were telling me yesterday that probably 70% of their time working with peers is trying to get them identification. Because if you come out of the criminal justice system, or you come out of treatment, or you come out of wherever, and you don't have an ID, you can't get anything.
Yeah.
And so you're not released from jail, for example, with your ID. So you can't get housing, you can't get employment, like you can't get a driver's license. And it's things like that. But how do you sit there and explain to someone, and this is why you do the job you do, because how do you explain to somebody that that's a very real barrier for someone to their recovery? Especially when you have people that are like, well, if they really wanted to stay clean, they would stay clean. Well, cool. Like, that's not real life. Right?
I don't think the 107,000 people that died last year were. Is it really that,
You're right,
like if you
exactly.
just stop
because it's that simplistic of a, like, well, if they wanted to, they would. But, I mean, how do you convey that in an artistic way that makes people want to stay watching, that isn't just like a sob story? Like you weren't, because that's the other thing that we see a lot is like it's just so tragic and so sad and so whatever. But, like, that also wasn't the angle that you all had. So.
Yeah, our job is to make the significant relevant, and it's really easy to I stole that from a book, by the way.
I was going to say that might be the title of this
from a
episode.
book called The Elements of Journalism. There's but it does sound pretty fancy.
It sounds so fancy. Okay. Your job is to make the significant relevant.
Right, and it's really easy to have significant work that doesn't appear relevant. And so we know this is something significant, and I think we made it relevant by tying in the real world stories that people have experienced in the crisis, and also people who are on the front lines of trying to turn the tides. And I do want to mention that every person we interviewed, we asked, do you see this getting better anytime soon? And nobody came close to saying yes.
I know.
So it's...
and can I tell you, Matt, like when you asked me that question, I wanted to say yes. And I think I even said, like, I want to say yes. I want to retire early. Like, I would love for Prevent+Ed to go out of business. Honestly. And I say that to kids. I'm like, please help me retire early. And I think that everybody in the field kind of feels the same way. Like, it doesn't seem to be getting better, which is very disheartening. But also, the people who do this work are the people who believe in that, like, just, like, so you're saying there's a chance, right? Like,
yeah.
Like, we're hoping for the chance, but we don't get up every day thinking we're going to solve this.
Yeah.
Was that frustrating for you or defeating for you as you were working on the story?
It's frustrating to hear that from everybody, but it wasn't surprising based on just after the first couple of interviews, I guess. It was like, okay, this is really, really, really bad. And it is, but we can show people that there's hope.
Totally.
There is. We have 3 great FDA-approved medications to treat substance use disorder, but they're not deployed in the best possible way. They don't reach the people that need them the most. And there's a fundamental misunderstanding of why people use in the first place, and the other side besides just medication. It's not, and something like, other illnesses like diabetes or, I don't know if that's the perfect example, but
it's a chronic disease, yeah.
Right, where you get your medication and that's supposed to...
It can be treated and it can be, yep.
But with...
managed.
With substance use, most of the people are using as a means to cope with other issues that are present in their life. And those don't just go away, right?
Right, exactly.
So.
Exactly. And how can we, better understand the things that drive folks to experiment or use or need it to feel normal or whatever. I mean, some of that is coping. Some of that is also curiosity and experimentation. And those are things that we have to take into account. It is a very complex issue. And I think that the hope is there. Otherwise, we wouldn't be doing it, right?
Yeah.
And I can imagine that it would have been very frustrating to be doing this work and then hearing the same thing over and over again, like, nope, we don't see it getting better. Nope, we don't see it. But you doing the work is also sort of getting us one step closer, right?
Yeah, and I think showing people the real world better outcomes, and what the possibility for better outcomes can really allow people to allow the public opinion to change. And it's not we don't do this because we want to change people's opinion, but if you show them this, then we want it to be impactful, right?
I mean, you shined a light on possibility.
Yeah.
Which is critical for people in the field, for people struggling with substance use disorder, for people who love someone who are struggling with substance use disorder, for people in recovery, for policymakers, for all of it. Talk to me a little bit about the reception that this has had. I mean, obviously, we love it. We're giving you guys an award, and you're on the podcast, but a lot of people really loved this, and we're very grateful.
It was better received, much better received than I had thought originally. A lot of you put it out there and you're just like, okay, now it's out there. What do we do now? But it has over 1 million views on YouTube, so people are watching it, and not just in St. Louis.
Yep.
Other places around the country. And I don't want to make it sound like views are the only thing that we care about.
It's an indicator. It's important.
Right. But the fact that people are viewing it, we hope that people can get something from it. I think I mentioned it, but the one thing, if it can help reduce the stigma around the issue, which if we don't do that, then there's really, like, we can't go to the next step until we can sit at the table and treat this like the crisis it actually is.
It is a crisis. I was talking to somebody the other day, reporter, who's doing a feature story for a national news program. And essentially, it's like, if the federal government is calling this a crisis, if they're calling it an epidemic, if they're calling it what it truly is, then where is the response?
Yeah.
At that scale?
There's really not.
There's not. There's not it.
President Biden touched on, I can't remember I think he called it the Fentanyl Crisis during the State of the Union. And had mentioned a family member who was there who had lost his son, I believe.
Yep.
And that's great. I'm glad he mentioned it during the State of the Union. But instead of just saying we need to do more about it, there's so much action that could have been done yesterday that could, it's, if the politicians on the national scale aren't giving this the attention it deserves and passing bills that allow naloxone to be sold at a pharmacy without a prescription.
Yeah, that's a good start.
Which, I mean, why was that not passed in 2010? If we don't have that, then it's kind of hard. It's a lot harder to care at the local level if they're not treating it as, if they're not starting from the top down, right? So,
my last question for you: how stoked were your bosses when they saw like the final product and it's gotten 1 million views so far? I mean, they had to be pretty stoked, right?
Yeah. My boss JJ he was a special projects producer, and he was much more excited than I was. I try to be a little bit
like a reserved, like a low key person.
I try to be a little reserved about it. I am extremely proud of the work that we did, but he would like check the YouTube videos every day or just to see, because in the beginning it actually was. There were a few days where 100,000 people had viewed it within 24 hours.
That's nuts.
And we're watching it, after the first day, and we're like, we haven't promoted this on air. It's, we didn't set off a bomb and say, here, this is.
Right,
Yet
right.
It was just, so thanks to the YouTube algorithm for helping us with that. But, it's been, I hope that motivates other, our organization too at KMOV and other organizations to do more projects like that in the future, where you just step back and just take a little more time on the most pressing issues that St. Louis faces.
Any idea when we can expect part 2?
That's a great question. I've interviewed 3 people, a couple people in the treatment scene.
You haven't called me yet. No,
I have not called you.
I'm totally messing with you.
I always keep you in mind.
I'm totally messing with you.
I always keep you in mind. But yeah, hoping to interview a couple more paramedics.
Awesome.
Do maybe a profile of some people who are showing what outcomes are possible in those areas that we historically call underserved.
But they're ignored. They've been ignored.
They're ignored. They've been ignored for a long time, which is why they're more likely to use heroin and fentanyl in the first place.
And then die.
Right.
It's just, yes, horrific.
And so, yeah. But a few months, give or take, possibly. Okay. Who knows? It might also be September if we just keep.
But also what I will say is, I asked that question not really expecting an answer, because what I have learned about you in the short amount of time that I've gotten to know you is that you're just going to keep digging and doing the work and making sure that when it comes out, it's going to present the story in as many ways as you can, and you're not going to rush it. And it's really awesome that KMOV is also not rushing it. They're not like, we need a part 2 tomorrow. You're not like a Marvel movie. Like, it's okay. Take your time.
Yes, and I'm very thankful for that, and that we have that the space to do that, because it's a lot of time. It's more expensive than the most of the work, just because it takes more time. So
yeah. Well, maybe when it comes out, you can come back and talk about this again.
Absolutely.
Awesome. Thank you so much for being here. If you like what you heard, please consider rating, reviewing, and subscribing to the podcast. I'm just so thrilled that you were here today, but also that you're going to be accepting an award, because it's not an Oscar or anything, but it means something. It's from the field. It means something really important. So thank you for doing the work.
Absolutely. It really means a lot that a local organization would give me an award like that. There's awards in journalism, but I assume they're picked by other journalists. So when people in the community acknowledge that you're doing something to make a difference, it really means a lot.
You are the only person we even thought about this
year.
All
right.
For real. So
maybe that's not a great thing. Maybe.
No, well, there's other people trying. Okay, I'll say that. There's other people trying, but well deserved. So thank you very much. Appreciate it. Again, if you like what you heard, I've already said this, but I'm going to say it again. Subscribe to the podcast. Until next time.
Thanks for joining us at The Preventable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at prevented.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The Preventable.